that, if misused, can cause unreasonable fear, leading to unnecessary suffering and death.
There are new COVID-19 cases in North Texas,
and it is spreading fast.
Declaring a state disaster.
Fort Worth Mayor Betsy Price is expected to announce a stay-at-home order.
Dallas County will move to a safer-at-home order.
Our world turned upside down, forcing us to change our ways, forcing us to be by ourselves and focus on our health, because we had nowhere to be. What if I told you that in the city, the streets were empty, schools shut down, and businesses closed too? We hear words like
isolation,
social distancing,
the lockdown,
to wash our hands, to keep 6 feet. We don't know who to trust, but we're all in this together. We're all connected, all equally affected.
We know COVID-19 started in the city of Wuhan in China. Most scientists think that bats are the original source of the virus, and then it jumped to humans in a Wuhan wet market. But American intelligence is now saying that COVID-19 may have come from a lab. China rejects this claim entirely, and most scientists think it's unlikely too. On December the 31st, the Chinese government told the World Health Organization that a new disease had emerged in Wuhan. Wuhan was then locked down on January the 23rd. The next day, an article from Chinese scientists was published in the medical journal The Lancet. They said only 27 out of the 41 initial cases were linked to the market. So what were the other potential origins? The uncertainty gave rise to the theory that COVID-19 may have originated in a nearby Wuhan Center for Disease Control, or the Wuhan Institute of Virology. President Trump, always happy to blame
China,
now says he's seen evidence.
Yes, I have.
The director of the Wuhan lab denies it had anything to do with starting COVID-19. Early on, they silenced whistleblowers like Dr. Li Wenliang, who raised concerns about the severity of the coronavirus.
Evidence is that it was natural and not man-made.
A Hong Kong professor says she has evidence to prove the COVID-19 virus was created in a lab in Wuhan.
Most scientists say the novel coronavirus came from nature, but there remain gaps in our knowledge about its precise origin. Some have chosen to fill those gaps with conspiracy theories, even calling COVID-19 a man-made disease.
Hello everyone, I am Miranga. We are from Group A10. We are here to make a presentation on was COVID-19 man-made or natural virus. By considering current global situation, I think this is the most suitable and relevant topic to discuss because COVID-19 is affecting more than human health. Here are the key points that we are going to discuss today. Firstly, we would like to discuss some global situations and ethical and unethical aspects of the COVID-19. Then we are moved to the some relevant theoretical underpinning, applications and analysis side. Finally, we are going to discuss argument, recommendation and cultural aspect of the case. Then I would like to invite my friend to continue this presentation. Thank you.
If you ask anyone what they will remember most from this year, it will most certainly be the coronavirus. Good day. I am Ruini, and we will be exploring the answer to the elusive question, was COVID-19 a man-made virus or a natural virus? Coronavirus disease 2019, or COVID-19 for short, is a contagious disease caused by severe acute respiratory syndrome, coronavirus 2. That's a mouthful. The first case was identified in Wuhan, China in December 2019. The World Health Organization declared the outbreak a public health emergency of international concern in January and a pandemic in March. As of 6th December, more than 65 million cases have been confirmed worldwide with more than 1.5 million deaths. Common symptoms of COVID-19 include fever, cough, fatigue, and shortness of breath. More uncommon symptoms are aches and pains, sore throat, diarrhea, headaches, and among others. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These drops are too heavy to hang in the air and quickly fall on floors or surfaces. You can be infected by breathing in the virus if you are in close proximity of someone who is infected by COVID-19, or by touching a contaminated surface and then touching your eyes, nose, or mouth. The COVID-19 pandemic has had extreme impact on the global economy. It threatens health and economic security across the globe. Sri Lankan economist Vincent Mervyn Fernando noted that the pandemic will prevent nearly 24 million people across East Asia and Pacific regions from escaping poverty. The World Health Organization has expressed that this is the time for global solidarity and support, especially with the most vulnerable in our societies and particularly in emerging and developing countries, and that only by doing so can countries overcome the health and social and economic impacts of the pandemic. Thank you.
COVID-19 pandemic has raised a host of ethical concerns, especially in the area of medicine. It has overwhelmed health systems across the globe regarding ethics of allocating scarce resources and medical decision-making under crisis. This includes admission and treatment of patients, as well as withdrawal from life support due to the critical shortage of ICU beds, ventilators, and medical personnel. Priority is given to patients who are most likely to benefit from the treatment. Moving on, political misuse of the situation is also another concern which, if not addressed, may cause inequality in providing care and taking preventive measures. Massive resource mobilized as a response to the crisis has created opportunities for corruption. This can block life-saving resources from reaching people in need. Political misuse of the situation has been debated over how to handle the pandemic unbiased by political perceptions. In order to address this successfully, healthcare workers and politicians should work together in taking responsibility of public health, with increased transparency to allow prompt actions without compromising integrity. Another concern is the circulation of false news, especially in social media, without any ethical commitment, which may severely harm vulnerable groups of people. The source and the content of news needs careful and utmost consideration and should be scrutinized on the basis of ethical codes. The public health crisis emerging due to the coronavirus has been worsened due to the effects of misinformation. Not only that, there are high-ranked politicians and decision-makers who are easily manipulated by misinformation. Decisions of such powerful individuals can impose great harm to the general population. These highlighted aspects are only a few ethical concerns with regards to the pandemic. It is important that ethical considerations must be at the front line in the battle against the pandemic. Thank you.
Hi, I'm Tarindu. Let me to go through the analytics part of this presentation. When global economic crises are compared from 1991, we can say this is the most fastest and most rapid and most impacted crisis in the economies when you are compared into 1991, 2009 and 2020 economic crisis. If you take some indicators related to COVID-19, this is the status. You can see the global growth of world and the advanced economies and the EMDs has dropped in for nearly 4-5% in 2020. And if you take the global activities, you can see retail and mobility has dropped from almost 30%, and flight cancellations are like 75%, and open table reservation in the hotel industry, it's more than 80%. So this shows the impact. And if you take the consumer confidence, the Z-score value, US, Europe, Japan, all are going negative in major markets like US, Europe area and Japan. If you take the industrial production and retail status, they all are negative, right? If you take the reduction hours, worked hours of different industries, all are showing a negative impact year to date due to this COVID-19. So we can conclude that whether it's man-made or natural, it has created a huge impact on the global economics and the economics international business. due to various reasons. Thank you.
Thank you, Tarindu, for the analysis. Let us now look at some of the theories that basically suggest that the virus was man-made and not natural. One of the theories that has gained a lot of attraction and is probably the most popular theory up to now is that the virus was created in a Chinese lab where the testing was done on bats and then spread to the rest of the world. However, there is no such evidence to prove this theory, and researcher Xijing Li has proven against it, saying the samples of the COVID-19 virus does not match with the samples of the testing that was being done in the lab. Another theory is that the virus was spread through to 5G because 5G also came up during the same time as the COVID-19 virus. However, WHO has proven that the virus cannot be spread through electromagnetic waves and the mobile network, and that even in countries where 5G is not present, the virus is present. Another reason is that people believe that Bill Gates started the virus in an effort to have a major global plan of vaccination and installing digital chips in people as a result of the vaccination process. However, this is because Bill Gates gave a talk in 2015, a TED talk, which predicted the upcoming of the virus. However, there is no evidence to prove that Bill Gates is the reason behind the virus. Similarly, there have been many other reasons. For example, people believe that USA tried to bring in the virus into China as a part of their warfare. However, because USA is having so much of an impact due to the virus, it is expected that and there is no scientific evidence, it doesn't seem like a plausible option. So although there are so many theories that exist, there is no evidence, and therefore these theories are still conspiracy theories. Therefore, we cannot conclude that the virus, because of a lack of evidence, is a man-made virus rather than a natural virus. Therefore, I'd like to pass it on to Chanaka now, who will be talking a little bit about how the pandemic spread.
Hi, I'm Chanaka. I'm going to discuss about how this COVID-19 became a pandemic. The main reason behind this was World Health Organization, WHO, was reactive rather than proactive. They took some time to take critical decisions, and the delay was caused through the escalate this pandemic. Another thing is that there is no 100% success vaccine, though already 1 year time is over. Fortunately, now these days we have found some vaccine with 80 to 90% success. Hopefully, we have new hope for this pandemic. Another main thing is that one person can transmit to dozens in a few hours, which will increase the figure in exponential ways. Preventive action took by the Chinese government in initial stage was not sufficient. If they proactively took actions by completely locked down Wuhan in the Hubei province in China in the right time, there may be chance to prevent spread of this virus in catastrophic manner. Irresponsibility of some people is another factor. Role played by the world power leader, US President Donald Trump, is also a question mark. So these are the main reasons to become COVID-19 into a pandemic situation. So I'll invite my friend Lahiru to talk about recommendation for this crisis. Thank you.
Hi, I'm Lahiru, and I'm going to talk about recommendation. According to our research and analysis, we have identified several recommendations. The impact from the short-term recommendation can be seen immediately, and those are given as prevention steps to the current pandemic situation. Long-term recommendations are mainly focused on how to avoid or face similar viruses in future. Some of the poor countries do not have enough facilities, knowledge to face the pandemic situations. Having a global fund would help those countries to come from the situation quickly. Some rich countries are criticizing each other and trying to compete in many ways, rather than being a collaborator. Also, there are few countries which are competing with each other to find a medicine or vaccine to get maximum benefit out of it. But having a collaborative research effect and knowledge sharing on finding would lead to find more suitable situation quickly. As long-term recommendation, it would be useful to conduct scientific research and investigation to identify root cause of this virus. The intention of it should not to punish or blame, but to prevent possibilities that similar viruses which can be raised in the future. Global independent body that are governed by WHO should be established to take globally impact decision to prevent similar threats in the future based on the finding of the root cause and other researchers. It would be impacted to establish health policies and regulation by the WHO. Either way, every country should obey those. Thank you.
Thank you, Lahiru. Can you remember the time we spent before March, how we lived our life? Have you ever thought that our life is going to be impacted due to a COVID virus? No, we never expect this. That's a shock. That's the shock which is common to everyone, no matter where you live, who you are. That's not a matter. So there are things called new normal. Now we are talking about, everyone is talking about, because all of the living patterns, the way we should live is change. So we are talking about working from home. We are talking about wearing mask. Mask is became a very essential item in our life. We never thought about that. And wherever we go, we are checked. Our temperature are checked, and we are ordered sometimes stay at home, lockdown. So those are the new normals. That is the shock that everyone is facing due to this COVID-19 situation. I believe that life will never be the same again. The million-dollar question is COVID-19 a man-made thing or a natural thing? Our team has done a lot of researches and done a lot of analysis on information that we have found and presented here to identify whether it's a natural thing or a man-made thing. According to information that we have found, information that have proven it's a natural thing, and information that are available to prove that it's a man-made thing are not trustable, and it's not really proven yet. So we believe it's a natural thing, but all the people in the world should take the responsibility to make it a pandemic which hit every lives in this world. That concludes our presentation. Thank you very much. We are A10.